Welcome to HSSC, ATC online training, where we equip healthcare professionals with essential clinical skills to enhance patient care. In this session, we will explore infant cardiopulmonary resuscitation, CPR, covering its purpose, indications, required equipment, procedural steps, and key error prevention strategies. Understanding infant CPR. Cardiopulmonary resuscitation, CPR, is a life-saving emergency procedure that combines chest compressions and rescue breaths to maintain oxygen circulation in the body. Prompt and correct CPR improves survival chances until professional medical help arrives. Objective of infant CPR: to maintain blood circulation and oxygen supply to the brain and vital organs, to increase survival chances in cases of respiratory or cardiac arrest in infants. Indications for infant CPR: unresponsive and not breathing. Infant, respiratory arrest, cardiac arrest. Essential equipment: mouthpiece for safe ventilation, automated external defibrillator, AED with infant child pads, bag valve mask, BVM for assisted ventilation, pocket mask for effective rescue breaths. Performing infant CPR, step-by-step guide. Single rescuer CPR, ensure scene safety. Check for hazards before approaching the infant, assess responsiveness, tap the sole of the infant's foot, and observe for movement. If unresponsive, activate the emergency response system immediately. Call for help and retrieve an AED. Use a mobile device to dial emergency services. Obtain an AED if available. Check for breathing and pulse simultaneously. Look for chest movement and signs of breathing. Locate the brachial pulse by placing 2 fingers on the inside of the infant's upper arm. Assess for at least 5 seconds, but no longer than 10 seconds. Response-based actions. Scenario 1. Normal breathing and pulse. Continue monitoring the infant and wait for medical assistance. Scenario 2. Pulse present, but no normal breathing. Initiate rescue breathing. 1 breath every 2 to 3 seconds, approximately 20 to 30 breaths per minute. Rescue breathing technique. Position a pocket mask over the infant's nose and mouth. Perform a head tilt chin lift maneuver to open the airway. Ensure a proper seal and deliver 1 breath every 2 to 3 seconds, allowing the chest to rise. Reassess pulse every 2 minutes. If no pulse is found, begin chest compressions. Chest compressions and AED use. If no breathing and no pulse, begin CPR, 30:2 cycle for single rescuer. Use 2 fingers placed just below the nipple line for compressions. Alternatively, use the thumb encircling technique if preferred. Compress to a depth of 1.5 inches, 4 centimeter, ensuring full chest recoil. Maintain a rate of 100 to 120 compressions per minute. Provide 30 compressions followed by 2 breaths. Apply an automated external defibrillator, AED. Place 1 AED pad on the infant's front, chest, and the other on the back between the shoulder blades. Follow AED voice prompts to analyze the rhythm and determine if a shock is required. Shockable rhythm. Deliver 1 shock and resume CPR immediately for 2 minutes before reanalyzing. Non-shockable rhythm. Continue CPR cycles until the infant shows signs of life or professional medical assistance arrives. 2 rescuer infant CPR. The first rescuer performs compressions while the second provides rescue breaths. The ratio for 2 rescuer infant CPR is 15 compressions to 2 breaths. Rescuers should switch roles every 5 cycles, approximately 2 minutes, to minimize fatigue. Common errors to avoid. Incorrect tapping location. Always tap the sole of the foot, not the shoulder, to check for responsiveness. Incorrect pulse check. Use the brachial pulse, not the carotid. Improper compression technique. Avoid using the full palm. Instead, use 2 fingers or the thumb encircling technique. CPR interruption. During AED analysis, stop compressions only when the AED instructs analysis. AED, pad placement on a wet chest. Ensure the chest is dry before applying AED pads. Key takeaways. Single rescuer CPR. 30 compressions to 2 breaths, 2 rescuer CPR. 15 compressions to 2 breaths. Compression rate. Maintain 100-120 per minute. Compression depth. At least 1.5 inches, 4 centimeters. Minimal interruptions. Maintain continuous compressions with minimal breaks. Effective rescue breaths. Deliver each breath over 1 second, ensuring chest rise. AED use. Follow voice prompts precisely for shock delivery and rhythm assessment. Mastering infant CPR is critical for responding to life-threatening emergencies. Regular training and adherence to updated guidelines improve response efficiency and outcomes. For more instructional videos and healthcare training, visit our website at healthcaressc.in. Thank you.